as things get better, we're trying to do less of the press conferences. But there's some important information I got to put out about the federal government. But unfortunately today, after, I guess you got to choose your words wisely sometimes, of having 0 cases yesterday, we went up 16 in the last 24 hours. So we've said this before, it's like a roller coaster. We go up, we go down, and we were hoping over the last, 2 weeks or 3 weeks, and it's been actually 4 weeks since the Hudson Ave party, that this wasn't going to happen again. But as of today, there's 2,474 positive cases of the coronavirus in Albany County, 499 people under mandatory quarantine, to increase of 16 positive cases since yesterday. Among the new positive cases, we know 2 are healthcare workers, 7 have close contact to a positive case, and 1 had reported travel out of the state, and 6 other people they're still working on for a clear source of infection. 9,263 people have now completed quarantine. Out of those, 2,443 tested positive for the virus and have recovered. That's an increase of 7 recoveries. There are now 9 people hospitalized. We went up 1 hospitalization from yesterday. So we have 9 people in the hospital as of today, and the hospitalization rate being 0.36%. Yesterday it was 0.32%. So we have 1 patient currently in the ICU, and yesterday the number was 1 person too. But as you know, when we're on these control meetings, which actually we went down to 2 days a week and sometimes 3, but mainly 2 now, we look at the hospitalization rate. And General Murphy brings it up all the time, and Rubito, and they talk about the hospitalization and how it's affecting us going forward. So this is the highest we've probably been in a while, at 9 people in the hospital, but we got to continue to watch that. Over the last 5 days, there's been an average of 4.8 new positive cases. Yesterday, it was 3.2. If you, have any concerns with the virus or you want to get tested, please, you don't need signs or symptoms. Go to UAlbany, as always, 1-888-364-3065. Our mobile testing site with the partnership with Whitney Young, as always, 518-465-4771. RiteAid.com on Central Avenue and 155. Please go there if you want to. And then, again, remember just 4 basic things. Wear your mask, cough into your arm, clean your hands, and stay 6 feet apart. We'll continue to get through this. We've worked diligently to protect our most valuable residents at our nursing home since this began. I shut the nursing home down first before the governor did. I know it's been tough for families with loved ones. I know it's been tough for the workers out there that you can't go physically. You can see them from the windows, but you can't physically touch your loved one. And I know the rule that the governor said every time someone comes back positive, it's 28 days until you can have someone open up your nursing home. I don't think there's a nursing home yet that has opened up because of that policy, but I'll stand corrected if one has. It's been tough. Our workers had to get tested every 2 days, twice a week, and we brought that up to the control room and we knocked it down to 1 day a week, which was good. And the other problem that we've had, that when we knocked it down to 1 day a week, testing comes back 6 to 10 days. Now think about that. You're testing on a Monday or a Thursday. Tests are coming back slower because, believe it or not, nursing homes are a priority as essential workers like hospitals and stuff like that, so they don't come back quicker, so they get put back on the back burner. So we can literally take 3 tests before you get the first test back. So it makes no sense that you're doing all this testing, because by the time you find out if they are infected, they've already been, it takes 14 days or 10 days. It was taking on average 7 to 10 days more than 10 days of getting our test results back. So, I mean, just figure it out. So it really made no sense. But that's what we have to deal with, and we had to find solutions to the problems. But, when this all started, I want to say that, working in partnership with our nursing home and surrounding nursing homes and the Department of Health, we kept reaching out, and now the federal government, we were on a phone call yesterday at 16:30 with the feds, and basically they are now mandating, as Governor Cuomo has done first and foremost in this nation, I believe, taking the governor's leadership and they're going to make mandatory testing for all nursing homes for all their employees 1 day a week. But the difference is that the office, and it's getting done, we had the briefing yesterday from the Office of the Assistant Secretary of Health, and authorized by the U.S. Food and Drug Administration, FDA. So this is important for many reasons. The testing kits and nasal tests that will be getting done at Shaker Place, they are now providing us a machine so we can test in-house. Testing kit for one employee takes less than 15 minutes to turn around, so we can test them, and we'll know within 15 to 30 minutes, depending on the logistics, of if they're positive or negative. And what's that mean? It means that when we have workers show up and we test them, we're not waiting 10 days. So I do want to give a huge shout out to the federal government for providing this. We're one of the first counties in the state of New York to receive this, that are going to be receiving the machines. Eventually they'll go out to all the nursing homes, but I think there's like two or three that got selected now in the state, and then eventually we'll put out. And they're going to give us the testing kits. What's that also mean? Money. And I hate to say that, we're spending over $16,000 a week testing employees. I mean, it's been a huge financial drain, not just on our nursing home, but also on hospitals and their nursing homes and their staff. So by us being able to give the test in-house, we don't have to administer it, we don't have to, we do administrate our own tests. We have our personnel that are trained to do this, and they'll do it in-house. We'll have the machine to test in-house. That means we cut out the middle person, and we're going to save tax dollars, which makes sense going forward. So roughly we should be saving, now that we can do 100% of the test in-house, we should save upwards of $10,000 a week, hopefully more eventually over time. So that's a big savings, and it's big news. And what it also means, when we have patients that have to go out for care, we can get them tested before they go out and have that results before they get to the hospital. And when people are coming back, and we need to get them tested before we put them out into, into open areas with other people. So it's going to protect our residents that that we're caring for, and it's going to protect our workers. So it is pretty big news, and again, it will help with, eventually we can probably start doing more workers in the county as we open up and start bringing people back. Eventually, if that ever happens, because we're still not at 100% staffing levels. And as we get prepared for October, for the flu season, and we're getting prepared for a second wave if it happens, we have more tools in the arsenal to protect the workers and to protect the residents and do it in a safe manner. So I do want to say to the federal government, thank you. I'm glad that we're the first receiver of these machines. It's going to make a difference in the life of our workers, obviously, and it's going to give us accurate snapshots right away. Not waiting 10 days and saying, oh, well, it's been 10 days at this point, or getting getting the test back and then literally getting the next test from a week ago after it. So it's going to be useful, and it's going to help us going forward. But again, thank you to Larry Slacky and the nursing home people out there that went after this, and again to the federal government finally doing what the governor of this great state of New York's been doing, and now making it mandatory across this country to be tested once a week, but also providing, I want to say thank you to the federal for providing the equipment to do the testing, so it's not going to cost us that much more going forward. Dr. Whalen.
Thank you, County Executive McCoy. From our perspective, we continue to monitor the cases as they come in. Yesterday was definitely a bit of a blip, but sometimes we find that this can occur. There is, when we get a lot of cases on Tuesday and no cases on Monday, we're cautious of the fact that the reporting may have been delayed, and we're diligently doing case investigations to determine if that's the case. But as always, we are identifying all close contacts, making sure that people are isolated as appropriate, and those close contacts are quarantined. We continue to advocate for testing. With the changes that we're looking at in the county in the next couple of weeks with the resumption of school and universities, it's going to be very important that we continue the messages around the important behaviors that can prevent COVID spread. And, we look forward to working with our school and university communities going forward.
Thank you, Dr. Whalen. And again, that's one of the bigger questions we continue to get from parents with kids going back to school very shortly. It's going to be September 1st, believe it or not, around the corner. I believe we're getting into 166 days today since our first case, somewhere in that neighborhood. But we are doing our due diligence, and we are working with the superintendents in the schools, and trust me, they're doing the same thing, the superintendents and principals and teachers. We're there to protect the teachers too, and to make sure that they're protected, and how we're going to do this going forward. Again, we got to try it. We got to continue to open up and move forward, and hopefully don't have a setback in October. But as always, please, to everyone out there, that needs mental health support, it's available 7 days a week, 8 a.m. to 5 p.m. And the number, as always, is 518-269-6634. And our 24-hour sexual assault hotline number, 518-447-7716, and the New York State hotline. And to everyone out there that has issues, please, that's what these lines have been established for. Reach out to them, and we want to be there to help you. And continue to do the right thing. We'll continue to move forward, and trust lies in us when we say this to all the parents out there, because we are parents. We want to do everything to protect you, but we also need you to do the right thing to protect your kids and your loved ones, again, by wearing your mask and doing everything the right way. Thank you.
This could be either for either of you. Albany just reported its first case. They've been open a grand total of 2 days. Just trying to get your reaction to that, and if you guys are working in conjunction with them in any way.
Absolutely. I talked to President Javier Rodriguez and on Ashley and Jim Latris. So we're going to be doing a press conference at noon out there today.
Does that discourage you at all that they've been open for 2 days and suddenly they already have a case?
No, it means that they're doing their job, and the fact that they caught it so quickly. These are new protocols that school put in place, and I don't want to speak for the president and the new chancellor, because they'll be talking about that, but it's the same thing at Siena College with President Gibson. They're tackling this. We don't want to see what happened to Notre Dame and Michigan have the same problems here. We've been a little bit tighter on it, and I think the controls that they have in place should stop a spread, hopefully stop a spread. Again, we're all learning, and it takes these college kids to do the right thing too. We see what happened when they had a big party. So if they educate themselves and do the right things in the dorm, it shouldn't be a bigger issue.
As it relates to schools and colleges, this new testing is really interesting. I'm wondering, at some point in the future, could it be standard similar to how we have like metal detectors in the front of schools, and then you enter after being screened? If the turnaround time for a test is just minutes, that schools could have those, so where you could allow people to walk around without masks if they pass their COVID test as they're entering?
So I don't know that it would obviate the need for masks, but I will say that the testing space is something that is in rapid evolution. We're really looking at availability of options like salivary testing, any point of care testing will be, I think there will be developments in the next few weeks or months. So certainly it will be helpful for us to be able to identify people with COVID in a shorter period of time. But there's always that question about the incubation period, and because we know that the virus is still circulating, and because the incubation period can be between 2 and 14 days, masks are still going to remain an important strategy, along with hand washing, social distancing, and avoiding large gatherings.
You sort of led into my other question, and that is the saliva testing. Apparently, the NBA partially funded the study that led to the eventual approval of this by the federal government. What do you know about saliva testing?
Not much. I think at this point, what we know is that there are many different tests that are currently being vetted, and as the studies come out, we will know more. Because the space is currently so populated with so many different tests, and because of the nature of what we do every day at the health department, I haven't had a deep dive into looking at all of them. I'm more waiting to see what looks like it's going to be approved and in use, and as those technologies become available, we learn more about things like the sensitivity and specificity of the testing, which can help inform us. One of the concerns I have with these methods is that they do not necessarily go into an electronic lab reporting system like the PCR testing that is currently widespread. So as we roll out these technologies, and this includes the technology at the nursing home, it's going to be very important that we ensure that that reporting piece to the local health department is implemented, which will have to be them manually letting us know about positive cases.
So do you think it's at all possible, or is it a pipe dream that we could get to the point within the next year where a COVID test could be as simple as like a pregnancy test, where it's relatively instant and the turnaround and response is almost immediate?
I don't think it's a pipe dream. I think it's something that is actively being worked on. But of course, as you know with everything, the devil is in the details. So it's going to be dependent on cost, where this can be implemented, where it makes the most sense to be implemented. So there's a lot of decisions that need to take place before we can talk about how this might be implemented.
For the county exec, for the testing for the nursing home employees specifically, what are we looking at cost-wise?
It's been roughly a little over $16,000 a week, and then you got to remember before we had to do it twice a week. So it was costing us a lot of money to run these tests that the governor said we had to do. So this gives us a great, I want to thank the FDA and the Assistant Secretary of Health, because by getting our own machine up at the nursing home and we already self-administer the test ourselves now anyway, it's going to save us more money going forward. And again, it's a useful tool that we get it back in 15 minutes versus 10 days.
What's the monetary difference, though? How much are you saving compared to that $16,000 a week?
We'll probably be saving $10,000, if not somewhere in that neighborhood, a week going forward.
Is this only for the Shaker Place nursing home because it is run by a local government body? Couldn't the argument be made that any nursing home, because that's the vulnerable population, needs something similar?
Yeah, the federal government, great question. From our understanding was we were awarded it, and actually when we got the letter yesterday, it basically said it could have come like last week, and we didn't even know if it showed up. They were giving it to us first. Like I said, I think we're like 2 or 3 counties in the state, New York State, that are going to receive it now, and eventually the federal government's giving it to every nursing home because they are changing their bylaw or their guidance and basically saying you will have to test 1 day a week. So yeah, it's going to go out. I think they're going to end up putting out like 550 of them throughout the country.
And do you have a timeline on that? And is that something that's come up in the regional control room calls? I know those are normally these days about reopening and regulations, but is the state in any way involved in this? Because it seems like if the federal and state governments are sort of cooperating on that, it could be more effective.
I can't argue with that question, and I can just say this. I wish they were talking more, because we need leadership. We need to put our partisan politics aside. I know the election's 68 days away, but this is about the people's lives. This is about quality of life. I don't know, because again, we received the email, early in the morning telling us about it. We had we did apply for this, and then all of a sudden, I was on a 16:30 meeting yesterday with the FDA and with the Assistant Secretary of Health for the federal government, and they were telling us how they're going to be rolling this out, and it's going to go on a national level, and that it's going to be mandatory for every nursing home for future funding to make sure that they're testing every week. And again, it's the same guidelines that Governor Cuomo was well out in front on months ago, so that part's not new to us, but the fact that we're getting that machine and we're getting testing kits is huge, because it's been a huge expense on nursing homes. As everyone's aware of, running nursing homes is not cheap.
And last question. Last week there were a ton of press conferences about casinos, movie theaters, and no one had a press conference about this, but amusement park still closed. Any word on what's going on there?
No, I bring it up, and again, I think of Huck Finn's, right? Jess Brewer had a great plan, and it was all socially distancing, cleaning. How are they going to open up again? You just read in today's Times Union another restaurant that's closing down, that's been establishment for years. Unfortunately, this is going to happen. Turning Stone's open. Indian casinos are still gambling, and though I have not visited there, I know people, friends that have gone there, and they said everyone's wearing masks, not 6 feet apart, playing cards, doing slot machines. You have to come to a point where you got to figure it out, and they got to open up, because again, it's revenue that we're losing, but it's people's livelihoods that need to get back to work. And I can't thank Huck Finn's and Jeff and his family for stepping up and saving Huffman's Playland at that time and moving it to their location. And I'm afraid we may end up losing it again, because if they don't open up, I doubt they'll be able to open up next year, the amusement side of the house.
Hey, Dan. Yesterday you confirmed 0 cases in Albany County. The state confirmed 10. Can you kind of elaborate on how you get your numbers first, or the state gets them first, or?
Listen, it's a snapshot, and Liza just said it nicer than I have. Again, sometimes you see this. We had the problems with the people passing away in Albany County when I had announced 24 one day and 30-something the other time, when the health department started questioning it, because the numbers have been off since day one. And when we were trying to reopen, if you remember, that was one of the things that I fought on, that the numbers aren't right. They're not calculating the hospital rates. They're holding other counties against us. It's the same thing, and we've gotten through a lot of the hiccups, and this is still one of the hiccups going forward that, again, I don't fault state DOH for this, because they're dealing with every hospital across the state of New York, and when you got that much information coming in, you hopefully get it right, but unfortunately, we still have days like this.
I would say also that it's just really how you look at real-time data. And when you look at real-time data, things like at what time do you pull that data during the day makes a difference. Things like we get cases. Yesterday morning when I went in, our first pull said that we had 18 cases. So then you have to reach out to those 18 cases, and you find out there's a certain amount of those people that don't live in Albany County, and so we turn the cases over to the appropriate county. So it is a very dynamic process every single day. All of us get reports through the same place, but how we filter those reports and the time that we look at the reports can result in what looks like data discrepancies. But in the end, with the rectification process, we're pretty confident with our numbers.
I would like to say this to Dr. Whalen and her team. I put her EPI team and her stats and statistics up against any county in the state of New York and this nation. They have done a great job, and they've been a leader for not just the state of New York, but on the national level. As president of County Executives of America, I get to really pound my chest and say how great they're doing and the great stuff they're doing, so thank you.
Also, a high percentage of teachers are trying to push back school till October. What are your thoughts, and why do you think the percentage is so high at this point?
I think they're scared. I'm meeting with some union presidents of schools that want to talk about it, and there's nothing wrong with that. They should be. It's a different world, and doctors and nurses are used to wearing masks for surgeries and different things, but standing there in a classroom for 6 hours and keeping a mask on that whole time, it's tough for some people. And it was interesting, because a friend of mine who's a teacher gave me this plastic. I got to show it to you. It's a plastic thing, goes over your face, and then you put your cover on, and it projects your voice, and you can hear it better. So some of the teachers are going to use that, and it was pretty cool. I actually wanted to show it, and they're thinking outside the box of how they're going to be heard all day and how they're going to do this. I know my daughter is only being allowed to go back 1 day a week, and the rest is going to be on Zoom. So it's going to be interesting. We have to learn differently, and I think someone brought up a great question about the Gates Foundation and some other stuff. This new technology has to be put in place, and teachers got to figure it out. I don't want to speak for Liza if she has more to add to it, but again, we're trying to do this safely, slowly, and make sure that the teachers as well as the students are protected.
I would also say that, I think we had a lot of conversations last week with school nurses, with the school superintendents, and there were a lot of questions. I think that the schools have done a great job in fleshing out their plans for reentry, but I think a lot of them are a little bit concerned about the timeline and the fact that the notification about schools being opened was, in August. And so despite the fact that all of them had been working very diligently, there still was a little bit of, it's still a little close to school opening. We have heard from the state health department that we may get additional guidance. So, with that, hearing that on the 26th of August, I can understand that there would be a little bit of concern on the part of the teachers. What we would like to do, and what we aim to do, and what we have created is straightforward algorithms that can be used by our K through 12 schools so that they know exactly what will happen in conjunction with the local health department when they get a symptomatic person, whether it's a staff member or whether it is a student, and what happens when they learn that there is a positive test. What is the response? I think I've done I think I've ensured the district superintendents that we will be there for every step of the way, but the fact that we may be still getting additional guidance at this point is a little bit of a concern.
Any other questions? Thank you, everyone. Stay safe and healthy.